Welcome to the ALS Care for the Caregivers Episode 3. In this episode, we'll be discussing toilet transfers with the use of the sit-to-stand machine, as well as a pivot disc squat transfer, as well as a transfer to and from the tub using a squat pivot technique, and Hoyer transfers to and from a bed. Please take some time to read the following disclaimer.
This is a toilet transfer with a sit-to-stand machine. With your loved one secure in the sit-to-stand machine, position them so that they are ready to assume a sitting position on the toilet. Stop when you see or feel the back of their knees come in contact with the toilet and then lock the brakes. Use the control button to lower your loved one onto the toilet as you use your arm for additional back support while moving into the seated position. Once your loved one's bottom has come into contact with the toilet and they are comfortably seated, they are able to go to the bathroom. For the purpose of this video, Michaela had her bottoms on, but ideally you would want to transfer your loved one without the pants on in order for them to go to the bathroom. As far as getting the patient from the toilet back to the standing position, it's as simple as using the controlled remote to raise the patient. You can provide additional back support using your hand as well. Once the patient is in the stand-up position, you can unlock the brakes and transfer your loved one to wherever they need to go. Performing a toilet transfer with a pivot disc, make sure that the gate belt of your loved one is placed securely and position the wheelchair as close as you can to the toilet. Lock the wheelchair brakes and remove both leg rests and the arm rest on the side that you are transferring to. Make sure that your loved one's feet are in firm contact with the pivot disc and communicate with them so that the transfer is safe and coordinated. Make sure your body is as close to theirs as possible to avoid any strain on the back and provide knee blocking for additional support. Have the patient lean forward over their feet and have them assist you as much as they can by pushing up from their wheelchair. Transition the patient back into their wheelchair. Make sure that your body remains close to your loved one and reach around their torso to firmly grasp onto their gait belt. Have your loved one lean forward over their feet, and you and your loved one are going to do the work to pivot them back into the wheelchair. Once your loved one is seated, replace the footrests or any arm rests that you removed from the beginning.
Position the wheelchair so it is next to the tub at a slight angle as shown and lock the brakes. Place both of your loved one's feet on the pivot disc and remove the leg and arm rest closest to the tub. Have your loved one lean forward into your shoulder, grab a hold of the gate belt and assist them off the wheelchair and onto the tub platform. Their feet should swivel on the pivot disc as you move them. Have your loved one hold onto the platform as you assist in lifting their legs into the tub one at a time.
When transferring the patient from the tub to the wheelchair, first begin with a lateral scoot towards the side of the wheelchair to get them in position for the transfer. Be sure that the wheelchair is locked and in close proximity to the patient for a smooth transfer. If necessary, place your foot in the tub if you feel safe and help guide their legs outside of the tub. Have the patient then lean towards you, grab tight onto their gait belt, and do a squat pivot transfer back into the wheelchair.
Begin by scrunching up half of the sling. Roll your loved one towards you and place the scrunched up sling under your loved one. Now, roll your loved one away from you and unroll the sling so that it is fully under them. You may adjust the sling as needed so that it covers them from head to buttock. Bring the Hoyer lift over and position it so that it is directly over your loved one. Make sure to lock the brakes. Attach the loops onto the Hoyer. Next, you will want to cross the leg straps. Note how the straps get looped through each other. This is very important. Attach the leg straps onto the Hoyer as shown. The Hoyer offers multiple loops, so choose the one that best fits your loved one. Make sure the Hoyer handle is locked so that when you try to raise your loved one, it does not continuously fall. You may have to adjust the sling to ensure your loved one's head is supported by the sling. To do this, just grab a hold of the sling and pull upward until it supports their head. Continue to raise them up until they are completely off the bed. Your loved one should sit comfortably in the sling as shown. Unlock the Hoyer brakes and move them to their desired location. You may swivel your loved one around as needed. Once at your location, relock the Hoyer brakes. If someone else is available, have them hold onto the strap on the back of the sling to further assist your loved one into the chair. To lower them, slowly turn the metal handle located next to the lifting lever. Undo the loops and the transfer is now complete. Reloop the straps when you are ready to transfer your loved one back to bed. Make sure you loop the leg straps through each other as you did before. Ensure the metal handle is locked and begin lifting your loved one. Unlock the brakes and transport your loved one back to bed. Once your loved one is directly over the bed, lock the brakes on the Hoyer. Slowly turn the metal handle to lower your loved one into the bed. Undo all of the straps on the sling, and the transfer is now complete.